Hello, everyone, and thank you for joining today's conversation, Living and Working Through Disruption, Pandemics, and Social Change. I'm your host, Melissa Tizon, Vice President of National Communications for Providence. There is so much going on in the world today. COVID continues to linger. Many industries, including healthcare, are experiencing severe workforce shortages. We're seeing violence in our communities, especially gun violence. And the country seems divided on many issues, from climate change to access to reproductive care. And healthcare is right in the center of it all. So we're not only feeling it as a healthcare provider, but many of our caregivers and many of the healthcare professionals who are tuning in today are seeing this affect their own mental health and well-being. So these are the issues that we want to dive in today, and we have an amazing panel to have this conversation with. I'm excited to introduce Ali Santore, Chief Advocacy Officer for Providence. We also have Mary Ann Sladich-Lantz, Senior Vice President of Mission and Formation for Providence, and Arpan Waghray, Dr. Arpan Waghray, Chief Medical Officer for Behavioral Medicine at Providence. So thank you all for being here. And why don't we just go ahead and dive in? And Arpan, I'll start with you. So the Omicron variant is quickly becoming the major strain of COVID in the US. And the CDC is warning that the country could be in the middle of the second largest wave of the pandemic. 1 in 3 US residents live in a county at medium risk, and 1 in 5 are in high-risk locations. That can't be welcome news for people working in healthcare. So how would you advise caregivers in terms of coping with the fatigue that could come with another potential wave in inpatient volumes?
Yeah, thanks, Melissa. And definitely not welcome news. Our caregivers have already been through so much. If we retrace our steps and think about the early days of the pandemic, healthcare workers, everyone did what we know best. We jumped in with both feet and just started to help people, and realized that we were sprinting in what very quickly started to appear and feel like a marathon. And then, variant after variant, it seemed like the goalpost kept being moved farther and farther away. But through that entire process, there are some silver linings. There were things that happened. I mean, we are resilient. We learned a lot from each other. And there were some core things that came out of this that I think will help us as we move forward with whatever comes our way. And one of it was, caring for yourself is not something that comes naturally to most in healthcare, but some of that changed. Self-care did become an important part. We did realize that we are whole persons caring for whole persons. And in order to provide excellent compassionate care, we had to take care of ourselves first. So incorporating self-care in the course of our normal workday, not this other additional thing on the side, but it's a part of who we are, what we do, and how we show up. And this being done intentionally by team leaders and every one of us, was a critical part. And if I could use the analogy, you think about, personal protective equipment doesn't matter how busy you are in the intensive care unit or in the emergency departments. If you're caring for a patient with COVID, you always don and doff your PPE. So a concept that we've been thinking about a lot is, what is the psychological equivalent of that? How do you incorporate the psychological equivalent of PPE that just becomes a part of who we are? So you're not having to opt into self-care. It's just built in as a part of your normal workday. And again, like I said, these are things that happen at the level of an individual, but also at the level of a team leader. So how is the team leader building in things like, limiting the number of hours you're on a shift, number of shifts you take, creating a community, having a buddy system. But then at the level of an individual, there's so many levels lessons that we learned from across the world. The National Health Services in the United Kingdom built something called a going home checklist, had very practical things that allow you to create space between your work and your life. My personal favorite was what happened out of University of Michigan. They incorporated 3 good things, practice of gratitude. What were the 3 good things that happened today? And what was my role in making them happen? And so these are some examples, but trying to think about self-care and caring for yourself is going to be a critical part. I don't know if there are any other easier answers, Melissa, but we need to start with this.
Yeah, I love that 3 good things. I think that's a really important reminder that we need to a great way to end our day every day. And I think you're right in terms of silver linings. As caregivers, we traditionally have tended to take care of other people before ourselves, and so the pandemic really showed us that we have to put ourselves first if we want to be of highest service. And I think that's a great segue into a question for Marianne. You've had the opportunity to support caregivers throughout the pandemic. So what has been the most surprising thing to you as you've seen our caregivers work through the pandemic and respond to the crisis?
Thanks for that, Melissa. And I'm grateful, Arpan, to some of the things that you mentioned, because I think that, as you mentioned, there was a sense in the beginning that we were going to address what was coming at us from a pandemic, and that in a few months that it would be over and we'd get back to normal. And what we quickly learned is that this was going to be something that not only lasted over a period of time, but as a matter of fact, may be a part of our life for the foreseeable future. And that's just talking about the pandemic, not to mention some of the other, the disconnections or the conflicts or the tensions or the wrestlings, whatever you want to call it, that we've experienced throughout the last several years. And so, as you mentioned, Arpan, I think that sense of how do we incorporate a sense of groundedness into the very activities that are a part of what we're doing every single day. So when we think about self-care, there is a certain amount of how do I step away and pay particular attention to myself? And then there's other things of creating a way of engaging in what's happening right here and right now in a way that doesn't destroy me or make me feel defeated, but can in fact give me that sense of inner strength to be able to meet what's ever coming my way. So I think in answer to your question, Melissa, what surprised me, maybe what surprised all of us, what surprised the country at large, is the ability of our caregivers to respond to whatever was coming. It didn't mean it was easy, and it didn't mean that there weren't challenges every single day. And the images that we saw presented to us from hospitals and care settings around the country were so full of emotion and weariness. But in the midst of that, there was something that rose up in us that allowed us, with a strength beyond our own, the strength that we even thought we had, to be able to engage. So that, I think while we're not surprised by that, because it's who we are in some way, there was such a wow factor to that, and an incredible amount of respect for the kind of care that our caregivers have provided over the last almost 3 years. Well, certainly before that, and that'll continue beyond. But I'm going to say the other thing that I think might have been most surprising is, as I tried to be on the sidelines because I was totally useless in a care setting, but wanted so much to be able to support people, there has been and continues to be a deep, deep hunger for a sense of, just remind me who I am. Remind me what's important to me. Remind me to name those 3 things. So you can't just tell me once at the end of the day or at some point in the day, think of 3 things that you're grateful. You got to keep reminding me. Tell me again who I am. Tell me again what it means to be called to serve in this particular way. There's been a hunger, and that hunger has not gone away, but has only increased. And in terms of all of our caregivers at whatever position in the organization, at the bedside, at the top leadership, a deep opening to certainly the psychological, but I might use the word spiritual. Where is the spirit in me? What gives my life meaning? And if I can touch that every once in a while, then there's hope. And then there's a little bit more strength. And then I can do the next thing. I shouldn't have been surprised by that. But I think in many ways I was completely blown away at the willingness and the openness of our caregivers across the system to just be open and to hear, who am I? Where am I going? How do I want to act? And then somehow touch in on that.
That is so beautifully stated, Marianne. And I think that's one of the reasons that so many people have worked at Providence for so long, is just because we're able to delve into the spiritual side of what we do. Healthcare is a healing ministry, and it's a calling. So there's a sacredness to it. And thank you for just expressing that.
Important. Let me just say what's important there.
Yeah.
Is spiritual and religion are not the same.
Yeah.
So, so to make that connection, that sense of spirit inside of us is what gives our life. Spirit is the Latin word for breath. And sometimes we associate spirituality and religion, but it's really important that we make that distinction, because not every spiritual person is religious. And not every religious person understands the depth of spirituality. So I just want to make that distinction there.
Yeah, that's such an important distinction. Thank you for calling that out. And speaking of spirit, I think that's a good segue for Allie, because one of the things that we wanted to talk about today was climate change. And just with everything that our caregivers have been through, I think, one of the things that I don't know how we would be able to handle it if it comes our way, and it likely will, but like another wildfire or another, if you're living in other parts of the country, another hurricane, flooding, tornadoes. And so, Allie, climate change is an important issue for Providence. And I was just hoping that you could speak to, help make the connection. Why, as a healthcare system, do we care about climate change? What is the connection between healthcare and the health of the planet?
Yeah, thank you, Melissa. And first, I'll say now everyone can see why Dr. Waghray and Marianne are two of my most favorite colleagues at Providence, and it's a pleasure to be here with them today. I couldn't agree more with those comments. And to answer your question, Melissa, building off of what Marianne said around this call to serve, so that we feel individually called to serve, and then collectively at Providence, we feel called to serve to protect our common home, the earth, and advance climate resilience. And that's the concept of making our facilities, our communities, and our earth more resilient to these extreme weather events that you talked about. I often consider and talk about Providence as a microcosm for the United States. We span across 7 states with varying demographics, varying political ideologies, varying geographies. So we experience firsthand the impacts of these extreme weather events that are exacerbated by climate change. So we have the freezing temperatures in Texas. We continue to have wildfires across the West Coast. We had the extreme heat in the Northwest last summer, and our facilities within healthcare are not built to withstand those extreme weather events. So we have a responsibility, in order to ensure continuity of care, to invest in the climate resilience of our facilities. Further, as we look at the climate resilience of our communities, we know that climate is inextricably linked to health. So issues like air pollution, access to clean water, freedom from exposure to harmful chemicals, Those are all things that impact health outcomes. And at Providence, we believe that health is a human right, and we cannot have healthy people without a healthy environment in which to live. So we are combating the impacts of these environmental health risks firsthand by our goal to become carbon negative by 2030. This is a universal problem, climate change, which requires a universal solution. So it's been all hands on deck across the system to increase our climate resilience and address the impacts, the health impacts of climate change on our communities.
Allie, thank you for your leadership in this area. It's been really inspiring to see how much we've been able to accomplish in a short amount of time, and our goal is ambitious but incredibly inspiring. So, Marianne, back to you. Climate change, this isn't like we're just jumping onto the bandwagon here. The health of the planet has been part of our tradition, and it's rooted in our history. And I was wondering if you could speak a little bit about what this means to us as an organization.
Thanks, Melissa. Allie, I love the way that that you articulated the commitment to, and I like the terms, the climate resilience or earth resilience, that sense of we can bring this common home of which we are all a part to a place of wholeness again, because the earth is an organism and we're all connected to it. And Melissa, that's the essence of the tradition, is that there is an interconnectedness among all beings and all parts of the earth. Our Pope Francis would call that integral ecology, that no one issue is an issue in and of itself, but that every issue is connected. And so it is just a part of the DNA of Providence, and perhaps Catholic or faith-based healthcare in general, to understand that that we can only meet the health of people if we are concerned with the health of the whole world, which includes the earth. And so the tradition has long acknowledged that our presence as human beings on the earth allows us to be stewards of it, not owners of it. So in other words, the resources that we have available to us, all of the natural resources, aren't to be used for until there are no more, but we're to steward them, not just for now, but into the future and beyond. So we care for it and we nurture it, the earth, in the same way that we care for and nurture each other. And so, as Allie so beautifully articulated, we can't fully address health for a better world if we aren't connected to the health of the earth as well. And you said, Allie, that healthcare isn't made or able to care for the extremes and to deal with the extremes. I don't think we as people are either. These extremes that we're experiencing in the climate or in other ways of approaching life or whatever, we're meant to be more in balance and harmony. And that's that resilience, I think, that we're talking about in relationship to the earth. But we can use that word all the way around. It's balance, it's harmony, it's we're all in this together. It's the social order.
Melissa, if I may just build on what Marianne said, I just love what you said. And I was reminded of the South African concept of Ubuntu. I am because you are. Right. And as human beings, we're all connected in ways that might be invisible to the eye. So it's so powerful and essential. And who we are as a healing ministry defines us. Thank you, Marianne.
Yeah, I love the idea of interconnectedness and being reminded of that. And, unfortunately, we've been reminded of how interconnected we are with all the violence that's been happening in our communities, particularly gun violence. It shows up in our emergency departments. Recently, Providence has lost 2 of our own in gun violence, one in a shooting in Southern California, and then one of our former physicians at the hospital in Tulsa, Oklahoma recently. So Arpan, I was hoping that you could speak to how does this affect the mental health and well-being of the population in general, but also for caregivers who are, who are feeling the effects of society coming into the emergency department and they may not feel safe.
Yeah, no, Melissa, that's, it's a really important question. I think, so if for a moment, if you think about it, the trauma of gun violence, can ripple out into our communities, affecting families, children, far beyond those who were actually shot and injured. And I think we need to, think about this. I can say for myself, I've been scared at times to go out with my family in some public places right after I hear about an incident of public shooting. And I'm sure there are many such, many such anecdotes. I did spend some time to try to look at this, like have people systematically studied this to understand what the impact is. And I did find that actually the Children's Hospital in Philadelphia did, and particularly our children. So what they did was they tried to look over a 4-year period, and what the impact of gun violence was on the community, those who were not directly involved with the shooting, and just that ripple effect that it has. And it was interesting. They looked at 2,600 incidents of gun violence, in a certain geography, and looked at a 5-mile radius, and in the 60 days following an incident of gun violence, and they looked at the number of children who were brought in or presented to emergency departments, and 54,000 children were brought into emergency departments in that one study, just showing, how significant an impact it can have on the mental health of children. Now, I want to also take a step back, and we're all, of course, entitled, irrespective of our political opinions. We are entitled to our opinions, but we're not entitled to our own facts, and we do need to pay attention to that. And there are 39,000 deaths that occur by gun violence every year. It's important. There's a common myth, mental illness is mixed into this, and it's important that people recognize that those with mental illness are not violent. It's not, they're more likely to be victims of gun violence than actually cause gun violence. And also the fact that almost 60% of those who died by gun violence actually were deaths by suicide. It's also important to recognize some other things, like there are over 600 women every year who die by gun violence, by an intimate partner. They're in the health systems, we see this a lot. I mean, there are 392 injuries related to gun violence every single day. So just think about the impact, and it's quite significant. Now, there is hope. There are projects like there's something called a gun shop project where, the owners, gun owners, store owners are taught to look out for certain warning signs. And there's so many other things that have helped people and have saved lives. I think when it comes to suicide, particularly, when you create some space and distance, when somebody's having suicidal ideation, and creating some space and not having access to a lethal means can actually be the difference between life and death. You can then help them and get to a place, but those are important things. And the impact of gun violence, it is becoming and has become a public health crisis, and we do need to treat it that way.
Yeah, thank you for bringing up the aspect on suicide by gun violence, because I think that's something that because we often think of gun violence and mass shootings, but suicide is definitely an epidemic in this country as well. And so, Allie, a question for you is, with gun violence, as Arpan was saying, being a public health crisis, what are we doing on the advocacy front to address this issue?
Arpan spoke so eloquently about this, and I would augment his statement slightly that gun violence is a preventable public health crisis. So we are working at a policy level to make safety bipartisan, a word that we don't hear as much coming from Washington, D.C. or our state capitals, but we believe that there needs to be collective action in order to ensure the safety of gun use and to mitigate and eliminate unnecessary gun violence. So we have been strong advocates for the last 8 years, 10 years, even beyond, on common sense measures to reduce gun violence and to mitigate this preventable public health crisis. Arpan discussed the impact on our children, and firearms are now the leading cause of death for children over 1. And that is just, unacceptable for an organization that is dedicated to health and healing and safety. So we are trying to make safety cool and bipartisan from a policy perspective. And we've advocated for several policies, including, extensive background checks for the sale of firearms, banning and limiting access to assault-style weapons that are used in these mass shootings, and also addressing some of those domestic violence issues by prohibiting those who are convicted of former domestic violence felonies of purchasing a firearm again. And we also, most importantly, from a health and safety perspective, we've been advocating for funding to the CDC and the NIH to study the impacts of gun violence and the root causes of gun violence. So, we approach this as a safety issue, and we believe that the government should approach it similar to they've approached, driving in cars and things like that, which you take on an acceptable level of risk when you drive cars. But there's been a real evolution in the safety around driving, and that started, seat belts and brake safety checks and now backup cameras. All of those things were advanced through research and studying the issue. So we want to apply the same safety frameworks that are used across our country to the issue of gun violence and gun use, so that we can mitigate these terrible events that are happening across our country.
Yeah, that is a stunning statistic, Allie, about children of over 1 dying from gun violence. And I love the concept of safety being bipartisan. That's such a novel idea. So moving on to Marianne, since we're tackling all the tough issues today, let's talk about the recent Supreme Court decision to overturn Roe versus Wade. How does this decision impact or not impact the way we deliver care in our facilities?
Yeah, Melissa, you're taking us right into the deep end from one thing to the other. I like we want to make safety cool and focusing there. Really, in all seriousness, I would say that we could approach the recent Supreme Court decision from a variety of perspectives, and the question I think that I've gotten from many is, how is this going to impact the care we provide in our hospitals, in our facilities? And quite frankly, the exquisite care that we have provided women over the decades will remain. We have not offered elective abortions, and we wouldn't intend to do that going forward. So so worrying about, were we able to do something and now we can't, that actually isn't an issue for us. I think what is important for us to acknowledge is, nor will we stop providing the exquisite emergency care that is provided for women as they present in our emergency department for whatever issues they may have while pregnant. And so our focus continues to be on providing the best possible care, the most exquisite, excellent care that we can for women, for men, for children, for all who come to us for care. So that doesn't change, and the procedures that we provide don't change. Obviously, there are the social issues and concerns that we have around that, and we have certain things that we have to continue to wrestle with and pay attention with on a societal or cultural perspective. But our care remains steadfast, remains compassionate, remains excellent.
Yeah, and we've also done a lot of work around maternal mortality, which is an issue that has tended to affect some of our more vulnerable mothers. We've gotten to nearly 0 preventable deaths since 2017. So we've done a lot of work on this issue. And it brings us to the topic of health equity. So Marianne, I was hoping that you could touch on why health equity is an important aspect of our mission.
So, Melissa, as you just mentioned, that infant mortality and really those who are on the margins, or those who are most vulnerable or economically poor, suffer greatly from some of the inequities. And so I think that we've been able to move the needle on infant mortality and other issues around health equity because we've intentionally put effort there. And so you might ask the question, well, why? And I think it's important to know that that certainly the mission for Providence and for other healthcare systems like ours is that there is a call out that we talk about, which is especially those who are poor and vulnerable. And so when we think about health equity, it's important for us to pay particular attention to those for whom inequity might be something that they've experienced most often. Our intentional focus from the beginning, when Providence first began its work, has always been focused on those who are most poor and vulnerable. That's been the essence of who we've always been. And as we are more consciously aware of what inequity means, and health inequity in particular, we have no choice really but to exercise that sense of who we are, and to address issues of inequity in the communities within which we serve, and in the country and in the world.
Yeah, and the inequity, eliminating inequity isn't just about the care that we deliver, but it's also about being a voice for those who are voiceless, which I think is a great segue for Allie to talk about what we're doing on the advocacy front to improve health equity. Absolutely.
So this is one of the reasons that I get up every single morning and love to do what I get to do for the organization. Is advancing health equity via public policy. And we work on that at both the state and the federal level. You know, you touched on maternal mortality, which is a big indicator of health equity in terms of health disparity and outcomes. So at Providence, we've been working at the policy level to extend healthcare coverage to moms and babies. And so we just had a great advocacy victory in getting the states of Oregon and the state of California to extend Medicaid coverage, which is the program that covers moms and babies and poor individuals. So that coverage is now extended 12 months post delivery of a baby. And so we're working to ensure via public policy that all moms, all babies, no matter what zip code they're born into, have access to the healthcare that they need. So that's a key example. And then, you know, another issue that tying back to what we talked about, this interconnectivity between health and the earth. You know, Pope Francis says that the cry of the earth and the cry of the poor are inextricably linked. There is significant environmental injustice happening across this country that it's insidious and it's not discussed very much. But for example, while Blacks make up 25% of the US population, 82% of the waste disposed in the United States is disposed in a Black neighborhood. And Black individuals are 75% more likely to live near a facility that disposes of hazardous waste and chemicals. So there is extreme and deep environmental injustice that our country has a long history in perpetuating. So the policy, you know, we're working on our operations, we're working on our climate, you know, to green our operations, we're working on our climate resilience that I talked about, but we also have a very strong focus on environmental justice and ensuring that these poor and vulnerable communities and communities of color have access to clean drinking water, have access to clean air and air free of pollution, and that there's a policy framework to rectify this long history of environmental injustice that we've suffered in America.
Yeah, that really brings us full circle, talking about how everything is connected, how we're all connected in it, and it affects our health, the health of everyone. So I think we'll close out with one more question, and this one is for Arpan, and it goes back to the staffing shortage. It seems like the whole world is understaffed right now, hospitals and clinics included. What would you say to caregivers who are exhausted and approaching burnout?
Well, that's a tough question, but a really important one. The first thing I would say is first, it is never solely the responsibility of an individual to address burnout. It's the responsibility of the organization. And my favorite quote from Christina Maslach that really brings this to life is, she once said that you never try to investigate the person. You never try to analyze the personality of a cucumber that's turned into a sour pickle without analyzing the vinegar barrel in which it was submerged. So if you think about it for a minute, it is our vinegar barrel. It is the conditions that are created that lead to burnout. So there's 6 areas of imbalance. If there's a mismatch in these areas, then it leads and drives towards burnout. So workload, you mentioned that, workload and work capacity. If you feel like there's a mismatch, it is going to lead to problems. It is going to lead to burnout, perceived lack of control, your value of autonomy versus what you feel your organization is giving you, your values. I love the way Marianne called this out in the discussion around the really tough discussion around Roe versus Wade and so on. Your values and your perception of your organization's values. And if there's a misalignment over there, it is going to lead to burnout. The principle of fairness. Are you being rewarded, for your efforts in a way that's fair? The sense of community. So these are things that we all need to focus on. I would say that workforce shortage, and that's probably one of the leading ones. And the Office of the Surgeon General just released a recent advisory that calls out a lot of these things. And there are ways in which we can start focusing on, we can start, eliminating what they call the stupid stuff. Are we actually doing things that are effective? How much time are we spending in doing things that are not directly going to improve the patient's lives? And how do we eliminate that? How do we think about technology? How do we leverage technology in a way that makes our lives actually better? And I think all of these things are going to be important. There's no single silver bullet, but I think it's going to be critical as we move forward.
Well, thank you, Arpan, and to Allie and Marianne. What an amazing conversation this has been. And I feel like we've just touched the very tip of the iceberg. I think we could go on for much longer talking about all of these issues, but thank you so much for joining us today. And thank you to everyone in the audience for tuning in. If you've enjoyed today's discussion, you'll find other conversations from Providence on your favorite podcast platform or on Dash Radio under Future of Health Radio. Be sure to follow us on social media. We can be found on Twitter and Facebook at Providence and Providence and Instagram under Providence Health Systems. To learn more about our mission, programs, and services, go to providence.org. As a reminder, the information provided during this event is for educational purposes only. If you have any questions regarding medical conditions or treatment plans, please consult your physician. At Providence, we see the life in you, and we are so privileged to be able to engage with you in this conversation today. Thank you.